This show was created to highlight the great work done by many of our Lincoln nonprofits who are members of Cause Collective. To learn more about Cause Collective and how we help our members better serve the community, visit our website at www.causecollectivelincoln.org. While you're there, you can also sign up for our free newsletter to read all about what our members are doing and how you can support them. Just click on Community Newsletter under the Community Outreach button. Today, we're talking to Kate Bolz, the President and CEO from Community Health Endowment, and Ron Kellogg III, Community Builder with Community Learning Centers. To get us started, Kate, welcome. Could you tell us a little bit about yourself?
Sure thing. Thanks for having us. We're glad to be here this morning. I am the president and CEO of the Community Health Endowment. I come to this work from a long history of government and nonprofit work. I started listing the numbers of nonprofits that I've worked for in my life, and my husband got bored. So I have a lot of experience in this area, and I'm thrilled to now be in a role where I can fund and support nonprofits in the Lincoln community.
That's amazing. Can you tell me a little bit about your work with the Community Health Endowment?
Of course. In 1998, Mayor Johans created a task force to discuss what to do with Lincoln General Hospital. That task force ultimately recommended that we create an endowment to fund health care services and programs in our community for the long term. And that became the Community Health Endowment. Our mission is creating the healthiest community in the nation. And our vision for a healthier Lincoln, one of the things I really like about it is that it's very comprehensive. Our vision is a Lincoln where all people are valued and an environment which is safe, inclusive, supportive, and culturally sensitive, and all people have the information and support needed to make responsible individual and community health decisions, and all people have high-quality, affordable health services, and we are recognized as the healthiest community in the nation based on comprehensive and accurate measures of our health status. That's a lot, but everyone needs a comprehensive, healthy life. We need our bodies and our minds to be healthy, and that's really the vision of the Community Health Endowment.
That's an amazing and really aspirational mission and vision. Having the Community Health Endowment kind of take the lead on that. Can you tell us a little bit about some of your partnerships and how you're helping nonprofits and the community at large achieve that vision?
Absolutely. I'd love to. The first way that we support nonprofits is by providing grant funding. We have a 15-member board of trustees that's led by members from our community, and we support projects related to early and adequate prenatal care, healthy food access, mental health and well-being, and something we're going to talk a little bit more about later today, youth fitness. So grant funding is the first way that we support our community. The second is through being an engaged community member. Our staff serves on advisory boards, participates in community events, helps with strategic health planning with the Lincoln-Lancaster County Health Department, and provides other services and supports in the community. And the last way is by providing education and information. We publish a biannual data report called Place Matters that people use to help better understand health needs in our community. We create annual community conversations and other products to help lift up both issues and the nonprofit organizations and community leaders that are responding to those issues and needs.
That's amazing. That's such important work. I noticed in your latest release of your announcement about the grant funding, you're also supporting, some mental health initiatives. Mm-hmm. Is that new this year or?
It's not new this year. Okay. But one of the things I think is really wonderful about that is in a number of projects, there's an intersection between mental health and well-being and another aspect of health. So for example, we fund the Asian Community and Cultural Center to provide information and education to pregnant women about how to make sure that their babies are born healthy. At the same time, they are doing mental health and mental wellness screening to make sure that mommy is healthy before, during, and after her pregnancy, especially because we know that things like postpartum depression are very real. So it's really fun to see projects that bring that holistic vision that the Community Health Endowment put forth in 1998, bring those things to life.
That's amazing. Yeah, that's such important work. So let's talk a little bit about the grants and who can apply for them.
Sure. We actually did our first webinar for the fall cycle today. So we are currently accepting new applications. We are open to funding nonprofits who are providing services in the Lincoln community. You can be headquartered elsewhere as long as your program or service is here in the city of Lincoln, serving one of the 4 funding priority areas that we talked about. And we like to see projects that are focused on health equity, upstream or preventative in nature, and are data-driven. Best case scenario, we can see how a project intervenes and moves the dial on the data outcomes that we're tracking, whether that's access to prenatal care or access to healthy food or fit and healthy kids.
That's really cool. So do you have in mind, like, what's a typical amount that you would award for each grant? It's
a great question. We have no minimum and no maximum. A couple of examples. We funded the Food Bank of Lincoln's Healthy Fresh Food Truck, mobile food distribution of fresh fruits and vegetables. We provided $75,000 over 3 years for that project. And as a quick side note, I've been able to volunteer with that project at Calvert Elementary School. And I'll share that it just brings joy to my heart to see kids come out of the elementary school and get genuinely excited about taking home a zucchini.
Yes.
It's really charming.
Oh, that's precious.
The food bank is doing great work there. So that's an example. The Asian Community Cultural Center project that I mentioned, we're funding for about $100,000 in a 1-year cycle. So it just depends on what the project brings to us and what the needs are, as well as, of course, our capacity for funding.
Nice. Well, tell me, if you can, what have been some of the successes that you've seen and that the Community Health Endowment has seen with these grant funds?
Yeah. I'd like to tell you about 2, if I can.
Perfect.
One that we are very proud of is that we have provided an initial commitment to the Cultural Centers of Lincoln Collaborative United Space, which is over near the U Street area. What's amazing about that to me is that it started just with a collaborative project. We brought those leaders together and asked how they could better coordinate to serve people in our community and address health disparities. And that collaboration led to a really big, exciting vision, which is a new facility that will house early education from the Malone Center, a food distribution from the Good Neighbor Community and Cultural Center, as well as other projects, programs, and services. So we're really proud of being an initial supporter of that project.
That's cool.
The other is close to my heart. I am a new mom. I happen to be an adoptive mom, but have been through a lot of the same ups and downs and challenges as any other mom. We fund an organization called Milkworks. We funded about $23,000 over 1 year to fund staffing and training to respond to mental health concerns of new mothers and to sustain some peer support groups. So my son happens to be a peanut. He's very small and very low on the growth chart. So I've been monitoring his health and his weight really carefully. And like any new mom, I'm a little worried, a little anxious, a little concerned, watching that baby closely. And I've taken my son several times to Milkworks to monitor his weight. Not only have I gotten that service, but I've also been checked in on. And it's really affirming to know that even though things are going really well for my family, that I can walk in the door and without any barriers or paperwork or even having to ask, somebody is checking on me as a new mom. And I think that's just an excellent example of not only addressing health disparities and meeting needs, but making sure that everyone can walk in a door and receive some TLC and support. So that's a favorite.
That's so amazing. Yeah, just a brief side note. When I was pregnant with my first son, I was introduced to Milkworks by my provider at the time. And then after he was born, he struggled to gain weight. Like he lost more than 10% of his birth weight. And I remember thinking, I don't think I actually ever went in, but thinking in my mind, okay, worst case scenario, I just go in there every single day obsessively, and they can help weigh him, and like, it's down to the ounce or whatever it is, however detailed that is. So, that's
what you may not have known in that internal dialogue is that if you had walked in, you would have found someone who is trained specifically to do this work. And I think people who are unfamiliar with breastfeeding or with early inadequate prenatal care might not understand the depth of knowledge and the skills and expertise that folks who specialize in this area bring forth. So rest assured, other moms out there, if you're driving past Milkworks and having the same internal dialogue, they're there to help.
Yeah, that's an amazing resource for Lincoln. I'm so glad we have that. And I'm glad that organizations like the Community Health Endowment exist to help support them. So I think that's really cool. So shall we shift to what's next? Tell me about what's coming up.
Do it. We are very excited about launching our Youth Fitness, Sports, and Opportunity Recommendations Report. Part of the data that we provide in the Place Matters report I referenced includes information about youth fitness. And what we noticed was a concerning trend in a couple of ways. One is that youth fitness was declining pre-COVID versus post-COVID. The other is that fitness, youth fitness, you can identify some disparities in higher poverty communities and areas. And that's where my friend and colleague, Ron Kellogg III, comes in. Ron has been working with a project called Get in the Game that is focusing on that issue in those communities.
Awesome. Well, Ron, tell us about your work.
So Ron Kellogg, community builder with the Community Learning Centers. I was privileged to have the opportunity to be a Tried task force member with two other incredible women, Dr. Beth Scott and Dr. Karen Kassenbaum. And over the past 13 months, as a group, we've tried to figure out ways that we can better incorporate a healthy lifestyle for the city of Lincoln. And so it's something that we're very pleased to share with the community. And it's hopefully something that the community takes on and grabs the bull by the horns so that we as a collective can make the city of Lincoln a healthy one.
We're asking folks to get in the game.
Nice. So this task force was formed, am I right, as a result of data that had been collected by the Community Health Endowment? Is that right?
Published by the Community Health Endowment, collected by Lincoln Public Schools.
Gotcha.
And we should
thank you
them.
for clarifying that.
Just an opportunity to thank them for their partnership.
Yes.
They've been wonderful partners.
Okay, also a brief side note, one of the things that I love about Lincoln is how collaborative all of our organizations are. So that's really cool. So the task force was formed in 2024? Is that right? Okay. Tell us about some of the ways that the task force is recommending our community to either become healthier or how, like, what's some examples of how the task force is helping?
Well, some examples would be like the Lincoln Bike Kitchen. They're giving out bikes to the community so people can be mobile in a different aspect. Our office, the CLC office, we offer a free sports league for 20 of our elementary sites
cool.
for students that are in grades 4th through 5th. This next school year, we're looking to expand to 2nd and 3rd grade. Just so we can get kids to establish some type of opportunity to participate in sports, which hopefully sparks them to continue on when they get into middle school and high school. And then there's another group like the Malone Center that offers their free sports for their students that participate in their community.
Tell us more about what would be a barrier to kids in our community being more active or being part of a sports program?
In particular, when it comes to sports, depends on what sport you're doing. There's a lot of high cost associated with it. So that could be one major barrier.
So like registration fees and traveling.
Registration, travel fees. Some do offer scholarships, but it's not as often seen as, other opportunities. Another thing would be transportation.
Right.
To and from practice. And that's not even including maybe going to games. And then I think there's an opportunity where we can spark interest for kids to try sports. Just like we were talking about earlier with the cost being a barrier. If I don't have the funds to participate, I'm probably not going to participate. So if we offer free opportunities for kids, just at least try it, they might seem to like it or find that they like it. So there might be an opportunity for them to continue.
That's really cool. So how is the task force specifically supporting that effort? You mentioned a couple of schools. How many schools again?
20.
20. Wow. Okay, that's amazing.
Yep.
And what were the grade levels?
It started with 4th through 5th,
4th through 5th.
And we're expanding to 2nd through 3rd.
That's really cool. And I imagine, and tell me if this is right, that it's not just going to affect youth at this point, but also going forward and inspire them, hopefully, for like a lifelong love of fitness or sports.
That's the goal.
Yeah.
I know everybody wants, when we're talking about sports, wants to be the priority to be winning. But in our case, the priority is we just want you to get out and move.
Yeah.
And be physically active. And so even if you're not participating, like in our sports league, or you're not with the Malone Center, like I mentioned before with the bike kitchen, we would love for you to go over there and take a visit, maybe see if you can get yourself a bike, because we have a beautiful trail system, the city of Lincoln. Not every community has that. So we would like for people to take advantage of that. But at the end of the day, when it's summertime, like in my neighborhood, for example, there's quite a few kids that live in that neighborhood. So there's really never a time where I don't see students out in the street or on the sidewalks playing. And so I would like to see that throughout the city of Lincoln as well.
Yeah, that's really cool. I'm wondering, the bike kitchen, how is your involvement? So anyone can go get a free bike from the bike kitchen. Is that true?
You can sign up.
Okay.
They have a sign up list, and unfortunately, throughout the year, they often have waiting lists.
Yeah.
They have relationships with schools and then with community organizations, so that they can help kids who would most benefit from a bicycle get in line first. One way folks can engage with this initiative is by going to youthfitlincoln.org. It's a website that the task force has created to publish our report and to offer an online sign up to get more information. We've got a few recommendations that the task force as a group is putting forth. And I should say that group, in addition to the 3 tri-chairs that Ron mentioned, include folks from Lincoln Public Schools, folks from nonprofit organizations, folks from the YMCA, and from Lincoln Parks and Recreation. So I think step 1 is really bringing together, as you were saying, a collaborative approach for the community, and then thinking about how we can tackle some of the recommendations. And Ron has been there since the beginning. So I might ask you, Ron, you want to talk about some of the report recommendations?
Oh, like the 5 recommendations? Oh, for sure.
Yeah.
So we decided that we capped it at 5. We had to narrow it down.
I can imagine.
An extensive group, so there was a lot of debate and discussion on it. So we came down to 5. Our first one is creating a backbone organization. And so with that backbone organization, we're looking to establish a central body to drive community efforts and also secure funding and then measure the progress. And so progress that we would measure would be like the PACER test pass rates and then swimming skills for youth. That was another priority that we wanted to talk about. Number 2 would be to expand fitness opportunities in schools and early childhood. We want to enhance early childhood physical activities, programming in both K through 12, and parent-teacher collaboration on fitness. I think there's areas where we can have a lot more collaboration than we do currently. Number 3 would be to increase community-based fitness access. So creating equipment banks, host fitness events, and then to develop neighborhood-based opportunities. That's something that the CLC office has tried with middle school kids for spring break camps. And so there's kind of an already in action thing that people could collaborate with or take the main findings of it and apply it to their own neighborhoods. 4 would be to promote physical activity via health providers. So to encourage healthcare professionals to prescribe fitness and educate families on resources. That came up in a couple of our task force meetings, and it was an idea that I thought was incredible. I thought we would already be doing that. So it's awesome that that's an idea that we want to give to the community.
Yeah.
And then finally, 5, improve access to public facilities. So we need to revise agreements between Lincoln Public Schools and the city to ensure equitable access to fitness amenities. And so we have all these great areas in town that we could utilize, but sometimes they are locked down for obvious reasons. And so just figuring out a way to establish a way for families and students in particular to go play on those areas would be greatly beneficial for our city.
Yeah, no, and I totally agree. And I'm going to just zero in. This is a ton of really important recommendations and goals. And I just want to zero in on that last one, access to fitness amenities. Can you give an example of what that might look like?
So an example would be like our Lincoln Public Schools field areas. A lot of them have tracks around them, and plus they have the turf, but they're surrounded by fencing that's usually locked. And so it'd be a collaboration between that school, making sure that it's open for a certain period of time for the neighborhood to participate and utilize those facilities.
Yeah, I have experienced that personally. Actually, my son's elementary school they did not have a fence around it, and that was frequently like a place that we would play. Mm-hmm. The kids would play. I would walk around the track on the outside. So yeah, totally support that. How would you go about encouraging the healthcare professionals to prescribe fitness?
I think it's one of those situations, and I'm trying to remember from our task force meetings, is if we could, instead of prescribing whatever else, I think a lot of the times just being able to go out and be physically active can sometimes be a great second solution to whatever you might find in that scenario. So I would say that's probably the main driving force in that. And I think it's something that pause.
There's a model called the Weight Assessment and Counseling for Nutrition and Physical Activity and for Children and Adolescents model. And gosh, Ron, why couldn't you remember that easily? That's a mouthful. But there is a nationally identified model that we've taken a review of. We do have Dr. Rauner, who served on our steering committee, who has helped us identify some of those best practices. And I think it's really public education and outreach. What are the tools that doctors could be using that we can easily and simply put in their hands so that recommending physical activity becomes an easy part of a healthcare visit? Other recommendations that we have include making sure that when parents and kids go to parent-teacher conferences, that those physical education instructors have something to offer as well. I was laughing with Ron earlier that I consider myself active but not athletic. I am not a coordinated soul. So if you asked me to play lacrosse or pick up a tennis racket, you're not going to get an enthusiastic response. But if you help me understand that skateboarding or dance or even just walking the trails can be a part of my physical routine, that really helps someone like me participate. So that's part of the goal as well.
That's amazing. Well, we're kind of reaching the end of our time here, but I just wanted to ask if there's anything we haven't covered that you'd like to mention.
People can learn more on www.chelincoln.org. That's a great landing place to find not only information about what we've talked about with the task force, but other great information that CHE offers for the city of Lincoln. That's
amazing. And where can people find the report on the Youth Fitness, Sports, and Opportunity Task Force?
Yep. You can go to youthfitlincoln.org to get information about the report and to sign up for future alerts.
That's awesome. Well, thank you so much, you guys, for being here. This is all the time we have for today. Thank you so much for coming in today and sharing your experiences and the great work of your agency with us and with the community. Thanks for listening to Cause Collective Radio on KZUM 89.3 Lincoln and KZUM HD, Lincoln's Community Radio. For more information and to listen to this podcast, visit www.causecollectivelincoln.org.